My name is Shelley White and I live in the Boston area. I'm currently in the Southwest US on the US-Mexico border.
Can you describe what you were doing as far as your activity around PPE as the pandemic started and as it kind of accelerated in the US and in the Boston area?
My response was actually, it sort of stemmed a little bit more personally from my family experiences. So all three of my siblings are frontline responders. As COVID took off, not only was I looking at it through a public health lens and as a professor and sort of observing some of the systematic things, but on a very personal level, I was actually doing Zoom workouts with my sister on a regular basis and getting sort of the day-by-day experiences that she was having in her hospital. And because she's a surgical nurse and really specialized in vent patients well, she was among the first folks that would be called in to work with vented patients. And of course, that included a lot of folks that were either COVID infected or could be COVID infected. So it was during that early period in March that she was sharing with me one morning that the previous day her hospital had told them they could just wear paper masks and they had to wear that mask for 3 days. And by the end of the first day, she had already just from condensation blown a hole straight through that paper mask. So she was essentially unprotected. And I think her experience was like many frontline workers where they were being told to have really judicious use of PPE, and it was putting them at risk. And so I just sort of panicked. And so from a very personal sort of gut response, I was really concerned. So I am not a sewing genius by any means. I've never followed a pattern in my life, but I had a sewing machine and a ton of extra fabric, and I just went into overdrive. So I just started making masks en masse, and I direct a Master of Public Health program. So by day, I was busily responding to the needs as we were navigating COVID as an academic program. And by night, I was a seamstress, and I was so exhausted. There were a couple weeks where I was sleeping maybe 4 or 5 hours a day. Within maybe those first many weeks, I made about 200 masks for different hospitals, starting with my sister's hospital and spreading from her unit to others. And then my sister-in-law, who's also a nurse manager for her unit. And then just little by little, as I heard of hospitals or different settings that needed masks, I was making them as many as I could. And then one cool thing happened, which is in speaking with my students in public health, I learned they were also making masks. So we did a mask making party to sort of share techniques and patterns, and that was really cool as well.
Did your students speak about how they became involved in making masks? Was it they just saw the need and wanted to jump in, or did they have kind of personal connections with folks like you?
I think both as well, through either personal or family connections or their own work where they were, frontline or essential workers. We're really just seeing the need and the inadequacy of what was available for folks. And of course, thinking about frontline workers, I'm speaking about folks in hospital or health settings, but it also expands to folks who are at grocery stores or pharmacies or custodial workers. There's really a lot of folks who are still on the front lines, or even public transport workers who've been not only on the front lines, but also faced some pretty contentious pushback about requiring customers to wear masks and so forth. So yeah, students who are making masks, I think we're doing so for a lot of different frontline or essential workers in those different settings based on their own interactions or personal or family connections as well.
You said that your sister and sister-in-law, were needing masks, that, your sister had breathed a hole through her paper mask. And so I feel like there's a lot of emotion involved. Anger, sadness, maybe confusion. And so I kind of want to ask, when you're sitting there making these masks, thinking about how, all of these workers aren't protected, the pandemic hit, we're not prepared for it, kind of what sorts of thoughts were going through your head, and maybe even emotions you were feeling as you were, sitting at your sewing machine doing that work?
I sewed and cried. It was super cathartic for me during the early part of this epidemic. I'm a public health professor and I'm looking at this systemically, and that's maybe an intellectual exercise, but I was also very much feeling it, in my heart and in my body in terms of, just the great unknown, the incredible risk that we already were aware of, the fact that folks were dying, the fact that we knew so little about the impacts of COVID on the body. Of course, at first we thought it was just respiratory, but then little by little realizing it's a multi-system infection. So yeah, I would say for me, as I'm sitting at my sewing machine, like I really did a lot of crying, and it was almost like a form of therapy to just like keep on sewing, do what I could, and take the little bit of joy in sort of delivering masks. There was like this level of gratitude from delivering like whatever 20, 40 masks to a hospital. I think reflective of the failure of our system, like that people would feel such joy to receive something as simple as these are just like cloth masks. And like I was reflecting a lot on the web of people that became involved in trying to do this, like seeing the fabric stores, seeing themselves as frontline and essential, which they were, but also those employees at times pushing back on their own safety in that circumstance and doing curbside pickup and so forth. I was lucky that I had a fair amount of materials, but I would say like the time sewing became also just a time to process and reflect on everything that was unfolding. But it was fairly cathartic, kind of processing the moment that we were in as a country, as a world system, and then just really thinking about the fractures of our health system that this really laid bare.
Does your sister and her colleagues or coworkers, do they mostly have the PPE that they need now from other sources?
I would say for the most part, things really took off, but it took a couple months. So like back in March, April, it was really scarce. And in fact, while she had a fitted N95, because having been a surgical nurse, she had that equipment, they were actually told they weren't allowed to wear it. They would be sanctioned if they wore the equipment in regular settings. So they were only allowed to wear it if they were treating a known COVID patient or if they were doing a procedure. But her procedures are fairly specialized, so those shut down for a little while in her hospital. Now things have evolved, and she's actually largely back to doing her standard job of specialized surgeries. And she feels, I think, more protected and more level. And I think it's a tenuous level, as with all of our frontline workers, because we're anticipating the fall and what that might mean in terms of the double whammy of a resurgence of COVID as schools are coming back, universities are coming back, cities are opening, and also like flu season overlapping with that, which will complicate symptoms, presentation, testing, resources, all of that. So I think at the moment, there's like this bit of like breather, and we're in the Northeast where we went through an early surge and things are more contained now. But here in the Southwest, like things are looking pretty different. So it also depends, I guess, like where you sit here in the US. Like our response has been so fragmented and so based on politics. And of course, mask wearing in itself has now become politicized, which is pretty remarkable to see. I think it shows that even when we have good science, even with that, it's just sad to see that even where there might be appropriate PPE, it's still becoming politicized in terms of whether folks are wearing masks or complying with like regulations, or whether the regulations are even there.
Do you see yourself kind of getting back at your sewing machine again and doing this work if folks do need the PPE like they did before?
Absolutely. And I've sort of not stopped. I mean, I think I went really into overdrive pretty hard in March, as a lot of people did when there was just such a dire shortage of PPE. But I've carried on, like I keep making masks. Right now I'm making a batch of masks that I'll actually provide for some of the humanitarian relief organizations working in the desert at the US-Mexico border doing work with migrants. There's been a lot of dynamics around the border and the shutdown of the border, new rules around processing asylum seekers to the US and so forth, and sort of this like, stay in Mexico approach at this border anyways, that is really, really concerning and continues to put people at high risk for COVID, including those that do enter and end up in our detention centers. So that's where like my mask making is concentrated right now. I think that COVID, like a lot of epidemics, really lays bare the inequities that were already pre-existing, especially around racial and ethnic lines that are now all the more deeply accentuated in terms of who is at greater risk, but also who gets care when or if, they do become infected. So that's certainly playing out here on the US-Mexico border. And so at present, that's where I'm doing my sewing for, but I just sort of am responding to where I am, who I'm in contact with, and where the need emerges. You know, I like to think about systemic responses because these like one-off, one-on-one, like individualistic responses are not adequate. And while I know that, I still participate in them because it's a part of the work. But I would say I try to balance that with my broader advocacy work, just in terms of thinking about how do we, yes, like make masks where you see the need, but that's just the tip of the iceberg in terms of what we really need to be doing is advocating for a more sane response, because what's happened at the federal level, what's happening at state levels, and all the way down to municipalities around the politicization of mask wearing itself, that disproportionately then puts especially communities of color and lower income communities at high risk, but also folks in these essential roles, these frontline roles, you know, in a variety of different settings. It's just it's a deep, deep injustice. So I do plan to keep making masks. For me, it's a bit cathartic. It's a space like to process while I'm also doing something that's like a little bit of good. But I really see my larger role and our larger role as a public health community around advocating for adequate policy responses.
What are some of the policy responses you like to see, or some of the advocacy points that you join or hear that you support?
I mean, you know, my background has been working in HIV policy and practice for a few decades, and like there's so many resonant points. And actually, Cleve Jones wrote a great piece in The Guardian recently about this, like what we can learn from that history and what we did wrong in terms of discriminating against folks, in terms of politicizing what should be good science. And we're just seeing it over again, right? So in this circumstance, we're ignoring the science and it's being undermined at the federal level. We're politicizing basics of like, not just how you protect yourself, but recognizing that health is a communitarian good. So I would like to see us reverse course on that. You know, it's so interesting because we're also at a really important historical moment around Black Lives Matter and movements for racial justice. And it's interesting how this very same people that will call out that these protests, which are essential right now, right? When you really look at who's dying from what, like racism is a massive structural determinant of health. We have to be calling that out and activating around that and taking precaution while we do. But it's the very same folks that will criticize that as spreading COVID and then like protest to open restaurants or gyms. So like, I think we have to name that juxtaposition and how off that analysis is in terms of thinking about who's dying and who's privileged to live in this country systemically. Like just last week, one of the advocacy pieces I was doing was around this proposed rule by the DOJ, the Department of Justice, and Department of Homeland Security that would truly weaponize public health and say on the basis of COVID, that if you come from a place where that's endemic, which hello, that's the whole world, or number two, if you travel through a place where it's endemic, again, the whole world, you're therefore disqualified from being processed for asylum. That's abhorrent. It's so unjust, right? And so like, not to mention that includes if you happen to be detained in the US detention center under Border Patrol proceedings and therefore became exposed. So in other words, we're punishing people for our inability to protect them under our auspices, under Border Patrol. So there's like all these ways that right now the politics of COVID are like overlapping with these pre-existing agendas that really disadvantage you know, certain communities. And that's very much, again, along racial, ethnic, and economic lines. And sort of speaks much more deeply to the histories of like colonialism and imperialism that, again, probably beyond the scope of this interview. But I just think COVID presents a really interesting opportunity to name what was already existing in terms of fractures in our health system that are so much more deeply accentuated. And then the way that overlays with like our climate crisis, just so many interesting dynamics. So there's a lot of work to do. And I think COVID gives us a unique opportunity because there's some really cool bubbling up like virtual activism right now along all of these lines. And I'm finding a lot of energy in those communities online and in ways of like commenting on a rule like that. It doesn't take a lot, but it's such an important moment to raise our voices as a public health community.